Coffee, what do you know about it? There's regular coffee. There's decaf. There's black. There's cream and sugar. There's espresso. There's lattes. There's cappuccinos. So what's the best thing to do if you like coffee? What do you do if you don't like coffee? Dr. Mark Anderson is a medical expert. I think we've been studying coffee, Doc, and the effect on our bodies for years. Anything new here you could tell us about?
Well, you're right, Joe. The studies come out say it's good, then it's bad. And in this study, they looked at its effect on small blood vessels and showed that there's a positive effect and could increase blood flow to the heart and make one at lower risk for having heart disease. So I think it's going to come back to the old deal of everything in moderation.
Yeah, but it's definitive now. There is some benefit to coffee, right?
Well, it's definitive only until the next study comes out.
Okay,
the most recent.
So you have regular, you got decaf. What would you prefer people to drink?
Well, the caffeine is what they looked at in the study as to whether it had a benefit. So, decaf is not going to be bad or good for you, but they did show that the caffeinated coffee did have benefits on those small blood vessels.
Mm-hmm. The blood pressure is affected in what way by having a couple of cups?
Well, it did go up slightly, as did heart rate. But, when we exercise, you get similar type changes, is that blood pressure will go up as will heart rate. And so one way to think of it is kind of you get that same physiologic response that exercise can provide to a lesser degree. So
the stronger the coffee, the better for you? Is there any connection with how strong coffee is?
Well, they did not change the dosage. They just changed going back and forth between caffeinated and decaf. So they didn't titrate it up to say, what's the maximal dose of caffeine or where do you start to lose that effect. They just took the enrollees, the study participants, and either put them on and off, and they were blinded as to what they were taking.
Do you have any benefit that you get by drinking it? Do you throw it out the window when you add cream and sugar?
Well, the caffeine's still there, so, what happens, I go in and get my cup of coffee, it's nice and black, and I watch everybody, get their double, triple latte, whatever, and they come out of there with a 600-calorie, drink. And so now you're getting the calories that are contained in it, not just the caffeine.
So if you want to have a latte or cappuccino, people are going to do it, and you said everything in moderation. What would be, how many of those can you have? A daily, weekly, lattes, things like that?
Well, I tell patients if they can measure it in cups, they're probably okay. If they're measuring in pots, they probably ought to cut back.
So, Doc, what if you don't like coffee? If coffee is good for you, and some people just can't drink it, and if some people drink it, they have to have the cream and sugar. And coffee, obviously, black the better. But what if you don't like coffee? What are some alternatives that you could derive the same benefit from?
Well, obviously, tea. And, this is one of those ironies. Chocolate has a substance in it called xanthine. It's very similar to caffeine. And then, you have your energy drinks, which I wouldn't necessarily recommend just because of such high doses of caffeine in those.
All right, Dr. Mark Anderson, the ups and downs, the ins and outs of a cup of coffee. Here are two. It's good for you, basically, until they come out with another study that says it's not good for you. These studies come out every day.